This is Chapter 1, Phlebotomy Practice and Quality Assessment. This PowerPoint is being narrated by the Program Director, Donna Oswald. Phlebotomy practice and definition. This is clinical decisions are based on standards of practice, diagnostic testing such as laboratory tests, x-rays, patient's history and observation of signs and symptoms. This would be essential to make note of when we're looking to diagnose a patient. What symptoms is the patient stating they have and what signs does the provider see? So for example, if the patient has a history of anemia, they might complain of symptoms of being tired, fatigued, and signs of this. We might observe the patient might have a paler complexion. They also might as well present with signs of lower red blood cell count. Standards of practice. Every area in healthcare has a standard of practice, things we need to abstain to provide quality patient care, and all these are used in the clinical decision making. Clinical laboratory test results. They're performed on blood specimens. They have increased in variety and number of test options available, nanotechnology, automation, and robotics, and they help the physicians in the clinical decision making. Although the patient might present with signs and symptoms, we need to do further investigation to determine what the patient is confirming is true. The other thing to make note of is that when they're trying to make their diagnosis, it's based on all these factors. Definition of phlebotomy is derived from the Greek words meaning phlebo, which relates to vein, and tonomy, which relates to cutting. So the words is venisection and venisection. Definition can be summarized as an incision of a vein for collecting of a blood sample for laboratory testing or therapeutic purposes. The blood sample removed should be small enough so as not to cause harm. Ideally, in a patient, we might draw 2 to 3 vials of blood, and in donation, they will take a pint from a patient. So the phlebotomist's role, the phlebotomist's primary function, assists the healthcare team in accurate, safe, and reliable collection and transportation of specimens for analysis. The phlebotomist or blood collector is an individual who performs phlebotomy. They also assist in collecting venous, arterial blood, urine, tissues, and sputum. Who performs phlebotomy tasks? Clinical and laboratory personnel, including phlebotomists, nurse, respiratory therapists, medical assistants, and clinical assistants, for example, or others who might perform phlebotomy tasks as well. The most common phlebotomy techniques is a venipuncture. This is a blood sample from a vein, not an artery, using a needle attached to a collection device. There's also the skin and dermal and capillary puncture. This is superficial skin puncture, typically a finger to withdraw small amounts of capillary blood, as shown in the image here. This is ideal for patients that are harder to obtain blood from or infants younger than the age of 1. How are laboratory tests used in the clinical decisions? They're used for diagnostic and screening tests. Are there abnormalities affecting the patient or irregularities that require follow-up testing? Therapeutic assessment to develop appropriate therapy or treatment of a medical condition, and monitoring. Is the treatment or therapy effective? So we'll look at the diagnostic and screening tests. During a physical exam, they might do a cholesterol test to determine if the patient's cholesterol is high or low based on the symptoms that they present with. A therapeutic assessment would be, for example, trying to develop a therapy to, let's say for high cholesterol, lower that cholesterol. And then they're going to monitor it and see, is the medication causing their cholesterol to come down or is it keeping it the same? This is the healthcare setting and healthcare teams. So it breaks it down by the Department of Clinical Pathology, Specimen Collection and Processing, and then the various departments within the laboratory: clinical chemistry, hematology and coagulation, microbiology, immunohematology, immunology or serology, urinalysis, and ER and stat laboratory supervisors. Phlebotomy practice settings. The settings range from inside the lab to the hospital, clinics, point of care, home health care, ambulance, remote places, inpatient, outpatient, acute, and long-term care facilities. Please see box 1.1 in the textbook for potential job sites. Become a professional, mature member of the healthcare team. Review box 1.3 on how to become part of the healthcare team. It's essential that being part of a healthcare team, we realize we have to collaborate as well as partake in various areas within the hospital. There's clinical pathology. Clinical pathology, blood and other types of bodily fluid and tissues are analyzed. Examples include blood, urine, cerebrospinal fluid, gastrosecretions, and synovial fluid. Anatomical pathology, autopsies are performed. Histology and serology procedures are performed on tissues and fluid specimens. This is fine needle aspirations and surgical biopsies are analyzed. There is a video. I will ask that you view the video in separate PowerPoint. This just goes over bloodletting history. It provides details and equipment that was used as well as the type of devices used by providers in the medieval times. So it's just an interesting video which can be seen underneath this presentation under lecture materials. Figure 1/4, I want you to become very familiar with this in your textbook. This is the pre-examination, examination, and post-examination phases. So what happens before testing, what happens during testing, and what happens after the testing. So the pre-examination process, the primary responsibilities are allocated to phlebotomists. The examination process would be technologists and specimen processors. And post-examination process is following up on those results, so this would be nurse and physicians. Identify the agencies that oversee the clinical lab. This is found on page 8. What I want you to understand is that all these agencies oversee our lab in different components, so it's breaking it down. The FDA, CMS, CLIA, OSHA, DOT, CAP, and ASCP. These can be viewed in your textbook and broken down. Agencies that oversee the clinical laboratories also include the Internal Association of Blood Banks, the Joint Commission, and credentialing agencies involved in certifying licensing laboratory personnel such as ASCP. Okay, clinical medical laboratory personnel characteristic discussion. Identify 3 to 4 common characteristics of clinical and medical laboratory personnel. This can be found on page 14. It's just something I want you to observe and also to realize that it's being detail-oriented, willing to problem solve, critically analyze certain things, also to being flexible is some common characteristics, but please view page 14 to get the additional information. Competency, certification, and professionalism for phlebotomists. This is high school diploma or equivalent is required. For phlebotomy education, length of training ranges from a few weeks to a few months. Pass a national certification exam and attend a continuing education program online through college or university. Please see table 1/2, box 1/6 in your textbook. Professionalism for phlebotomists. Professionalism is a skill, competence, or character expected of an individual and a trained professional. We want to have respect not only for our colleagues, but for our patients. We want to support both our patients and our colleagues, providing a service and growth. Okay, on pages 12 and 13, you want to identify 3 to 4 professional organizations for phlebotomists. What is the benefit of being a part of a professional organization? A benefit is a lot of organizations provide some type of continuing education, which allows us to stay up to date and current in the field. It allows us to obtain educational information to share with others. The other benefit is that a lot of these have some type of national test, which then shows that you met a certain level of criteria that might put you as a better candidate for a placement than some as well. Okay. Ethical standards for phlebotomists: we do no harm intentionally, perform according to sound technical ability and good judgment, respect patients' right, confidentiality, and privacy, right to know about their treatment, and right to refuse treatment. Please see box 1/7 in your textbook. This would be, they have the right to know what type of tests we're drawing and why. They have the right to refuse the blood draw. We cannot force a patient to do that as it's an invasive procedure. We need to use good sound technical ability and good judgment. So if when you initially look at a patient's arm, you can't find a vein, knowing your limitations and asking for help is crucial. Okay, I want you guys to think about 3 to 4 character attributes for this career. Pages 18 and 19 are essential. These are key things that as you make your journey through this course, that you want to go back and make sure that your character attributes align. Work with small objects, detail-oriented. A lot of it is critical analyzing, critical thinking as well. Appearance, posture, grooming, and personal hygiene, PPE and dress code. It is essential that when we look at the grooming and personal hygiene, that our nails are kept at a short length, that hair longer than shoulder length is tied back. If we have, for males, have facial hair, it's trimmed, neat. The other thing too with PPE is understanding how to apply it and how to remove it as well. Okay, tips to relieve and reduce stress: take time for yourself, humor and optimism, exercise, nutrition, and control the source of stress if you can. Some other things too is we want to try to leave at work and not bring it home. But taking time for yourself, whether it be meditation or taking a walk or you run, those are key things to kind of de-stress and reduce the stress in our life. Okay, quality assurance, control, improvement, and assessment. Perception of quality. Quality is excellence, high standards, high caliber of superior value. Categories of quality is scientific or technical, or non-technical or interpersonal. Okay, so we're going to look at some major concepts. So efficacy: the healthcare service provided has a positive impact on the patient's health, that is, the patient improves or gets well. Appropriateness: the procedure performed on the patients are the correct ones for that particular condition or illness. And caring functions: the services provided to the patient are available, timely, effective, safe, efficient, respectful, and sensitive to the patient's needs. So an example of this, let's say you go into the lab, you have your orders for a blood draw, and prior to going in, you were told by your physician to be fasting. You go into the lab and the phlebotomist is asking you your identification, your name, your date of birth, never asks you if you were fasting, and then that you ended up having to wait at least 15 minutes to get back to see the phlebotomist to get the blood drawn. During the procedure, they ended up having to stick you 3 times because they had a hard time finding a vein. So as we break this down, this mock case I just gave, we're going to look and see, does this have a positive impact? Does the patient improve? Well, the problem is that if they never confirmed if you were fasting or not, it may not improve, because if a fasting sample wasn't required, you just did something that you didn't need to do. Appropriateness: performed of the patients are the correct one. The appropriateness to drawing is that we'll never draw a patient more than twice. In this situation, the patient was drawn more than twice, which would then deem an issue with appropriateness. Caring function: available and timely. If you had to wait more than 15 minutes to get back there, that might have an issue. Is it safe? No, because they had to draw you multiple times and didn't confirm fasting. And it's not very sensitive to the patient's needs if the phlebotomist, the procedure isn't performing things accurately or having to repeat procedures. Okay, there's stakeholders and customers. External individuals or groups outside the organization. So this would be vendors that provide us with our equipment. Internal would be individuals or groups within a healthcare organization itself. So this would be the employees. It could all be the customer service aspect. Anyone that works inside the hospital that isn't coming in externally. And external individual groups outside the organization could also be, you as a clinical student. You're an external stakeholder, not an internal, since you're not actually employed by the hospital. Okay, quality initiatives. So there's a code of ethics that organizations evaluate employees' credentials and continuing performance. This might be performed by providing the employees with monthly newsletters and quizzes that show comprehension of material associated. So certifications, since there's ASCP, American Society for Clinical Pathology, and then there's continuous quality improvement, or CQI. So there is a Six Sigma and Lean Six Sigma. Six Sigma is used to define, measure, analyze, improve, and control. So we would define a problem. So for example, if we had continuous needle stick injuries based on a type of needle we use, defining this problem, needle stick injuries by the technicians. How would we measure it? How many times did the employees report that particular brand or type of needle was causing the injury? They'll analyze it by determining how many. So one brand of needle versus another, how many are shown to be defective and cause a needle stick injury? How do we improve? We would improve this by changing the type of needle we use. And then how do you control it? You control it by doing follow-up. So you'll follow up with the technicians with the use of the new type of brand needle and see, do we have more reports of needle stick injuries or not? Then Lean Six Sigma is an advanced way of kind of adding on to Six Sigma. This is framework principles. So speed, efficiency, and quick action. So speed would be, with the needle, have we noticed that the time frame we're with our patients is less? So with this new needle, we show, quicker draw rates. So our time frame for drawing a patient went from 5 minutes to 3. Okay. Efficiency. Does it work? Are we decreasing our needle stick injuries or not? And quick action would be, if there was a needle stick injury, are we following up on it right away? So what type of actions are we taking? Are we reporting it? Are we, just opting to not use that needle at all? So these are things, continuous quality improvement, that is used in our lab, not only for us as phlebotomists, but also too on patient testing. It also helps us increase our turnaround time, so how quickly we get test results out to patients as well. ISO standard for quality management, so customer focus, meeting and exceeding customers' needs, leadership, unified mission and strong leadership, and engagement of people at all levels of the organization. We want to make sure that we're customer focused, that leadership unified and supportive of both the staff, and that we have to work across different disciplines. So being able to do that and engagement of the people involved. Okay, so this is process approach, linkage among people, teams, and processes, improvement, reacting to changes in the internal and external environment, evidence-based decision-making, so using sound analytics and evaluation of data, and relationship management, identifying the important stakeholders. So knowing that as a team, we want to improve, so the internal and external environment. So for example, with COVID-19 going on, the internal and external environment has changed. Internally in the hospital, we're having to have more PPE involved, less interaction than we normally would. Externally, we're asking visitors not to come to the hospital. Anyone with positive symptoms, we're screening them before they could enter. So that would be a way we'd improve or change the environment based on something that's going on outside of the organization. So CLSI quality management system policies indicate intentions, processes, activities required to implement quality policies, and the procedure documents, instructions for performing steps. So we're going to look at the quality control plan. So risk assessment, quality control plan, and quality assessment. Risk assessment is for anyone that handles blood, there's the potential for bloodborne pathogens. How do we minimize that? What PPE do we have? What kind of training do we expect from the employees as well? So CLI, quality control plan, reliability, accuracy, and precision. So for in the laboratory setting, when we're getting test results, we want to make sure those test results are reliable, they're accurate, and there is precision when performing it, that we get the same type of quality control results for each time we run a controlled sample. Reliability is being able to reproduce the results. So we want to make sure that our reference ranges for high and low controls are accurate so that we're giving accurate test results. If any of those are not within range, we're following up on it right away. So quality improvement, this is healthcare workers technique, patient identification, waiting times, complications, recollection, repeat venipuncture rates, multiple sticks on the same patient, and duplicate test orders. I'm going to give an example of each. So healthcare workers technique, if we notice a technician is taking 30 minutes to draw 5 patients, and then we got another technician that takes 30 minutes to draw 15 patients, we might look at their technique. What is one doing differently than the other to give us a quicker turnaround time? Patient identification procedures, if we notice samples are coming in the lab and there's miss ID, so missing birthday, missing last name, we're going to go and reevaluate the employee, sure they're identifying their patients correctly. Waiting times, we're going to look to see in an outpatient setting, if it's taking us 15 minutes in between each patient to draw them, why is the waiting time so high? Complications, there's permanent complications by appropriate training. So if patient's really hard sick, there's IVs present, how to get around those complications to not impact our turnaround times. Recollect and repeat venipuncture rates. So this would be, for example, if you draw a patient and you forgot a test tube. You drew a patient and you didn't get enough sample. This would be a cause for recollection, and we would then go back to the phlebotomy care workers technique to see how we can decrease this. Multiple sticks on a patient would be, for example, let's say a physician ordered a lab test and then another physician ordered the same lab test an hour later, being able to realize that instead of sticking the patient a second time, we're going to look back at those old results. Did they have this test done already? And duplicate test ordered would be the same concept. The doctor ordered, let's say, a basic metabolic panel, and another doctor an hour later ordered the same test. We're not going to repeat the test again for a different provider. We're going to provide those results to the physician, both physicians, and avoid having to stick the patient more than once. Okay, tools for quality performance assessment. Analytical, clinical, laboratory scientists, and technicians use data to collect to ensure test sensitivity, specificity, and precision and accuracy. So test sensitivity is really crucial when we're looking at cultures to determine what type of bacteria might be present. So they want to make sure that those test sensitivities aren't so sensitive that we're detecting things that aren't present, but also having precision and accuracy to report out those results as we see fit. Tools for quality performance assessment. This is reviewing analytical and non-analytical parts of the laboratory. We could do brainstorming, flow charts, case and effect, so the fishbone diagram. So for example, in your book, it might say collection. If we didn't get a requisition, how is that going to impact kind of cause and effect? The phlebotomist is occupied, patient's inaccessible, so the patient was out of the room. The vein wasn't easy to obtain blood from. The specimen was broken and patient occupied. So it kind of causes the cause and effect, because if we don't have one of these, we may not be able to draw the patient, which then delays getting a test result. You can also use flow charts. Patient has requests for lab tests, appropriate information. If there isn't appropriate information, then we got to follow up on the missing information. If the information is appropriate, we need to locate the patient. Is the patient available or not? If they're not, then we may not be able to collect the sample at that time. Okay, so negative impacts, examples of QI Phlebotomy Services, usually preventable. So misidentification of a patient. So you go in to draw a patient and you don't confirm their birthday and it's actually the wrong patient. Hospital-acquired infection due to poor cleansing techniques. So instead of cleaning, you're cleaning the site with alcohol, you drop the needle on the floor and then you use that needle to stick your patient. Poor venipuncture technique that causes pain or nerve damage. This would be if we were taking the needle and probing inside the arm or using the basilic vein, which is the most high risk. Lengthy waiting time, rude behavior, or messy words. I'm going to have you view the do's and don'ts of customer service on this one, because this really is going to give you all of these components in a video format, which will allow you to see what happens to a patient when they have lengthy wait times, rude behavior, messy work sites. Messy work sites not only look unprofessional, but it's also an infection control issue, because if things aren't cleaned, then we don't want to transfer things to a patient coming in for care. Factors affecting quality in the specimen collection. So again, we're back to those phases of testing, the pre-examination, examination, and post-examination. And I want to stress this because this is used throughout this whole course. These are components that are performed during, before, and after testing. So there's patient variables, so the age, physical disposition of our patient, variables in technique, transportation, and then specimen variables. So these are things to view, especially the pre-examination, because those are the pieces the phlebotomist is actually responsible for. And then also doing follow-up. So if one piece isn't done, we document by traceable. So every time the specimen is handled, someone's initials go on that. So I, as the phlebotomist, will initial it. We'll give it to processing. They'll initial it. Give it to the people to examine it. They'll put their initials on it. So that way, if the specimen were to get lost in transit, we know who had the specimen last, and then we can track the specimen down. So basic requirements for quality specimen. This is to use standard precautions. So wearing gloves, hand hygiene, specimen collected from the correct patient, use correct anticoagulants and preservatives, fasting specimens collected in a timely fashion and should be fasting samples. So making sure the patient adheres to a 8 to 12 hour fast. Label, handle, and transfer specimens appropriately in a timely manner. Time specimens are correctly timed and documented. And generally when we collect a sample, the timing on it is after the draw is done. Specimens without anticoagulants are allowed to stand minimum of 30 minutes. We will review this in Chapter 8. But being aware that labeling, handling, and transportation of the sample is a phlebotomist's responsibility. So if we have a sample that needs to be done stat, which means immediately, that we get the specimen to the lab immediately after we draw. We don't let it sit in our work tray for an hour. So those are things that we got to keep in mind when we want a quality specimen. Future trends in phlebotomy practice. So again, ISOs. Electronic medical records allow physicians to view procedures and labs that were performed at other facilities. Smaller, faster laboratory testing, so nanotechnology. This is the use of a single drop to test blood, which goes into point of care testing. Direct access testing, so we're not having to get special administration of a test, so we can go to a facility and request a test. Direct to customer availability, so we provide services both in the home and in an outpatient inpatient setting. Robotics and drones, the use of robotics to potentially draw blood and drones to transport blood. So if we are in an area where there isn't a laboratory nearby, we can use drones to transport it. And then education and certification. As times change, the amount of continuing ed is also changed. This PowerPoint will be also available for you to view outside the recorded environment as well as the videos that were not shared in this PowerPoint. You can view those as well. It is recommended you read the chapter and complete the questions at the end of the chapter to prepare for the lecture test. This completes Chapter 1, Cliff Notes PowerPoint. If you have any questions, please direct them to your instructor.